My name is Roberta Hovermail, and I am the DDRC, or Developmental Disabilities Resource Connections Navigator. And I help families and individuals with applying for developmental disability eligibility, so then they can pursue waivers for themselves or their loved one. And I also help with connecting people with resources in the community. Some of them are through Stone Soup Group and others are through community members. So my office is over at the Matsu Health Foundation building, and you are always welcome. Make an appointment with me, and I'd love to speak with you. So I am going to go right now and I'm going to share my screen, and we're going to talk about Social Security. We're going to start with that first. With Social Security, one of the things is that sometimes individuals may talk about Social Security income, SSI, versus SSDI. And so SSDI is Social Security Disability Income. So there's two disability related programs, SSI, Social Security Income, and Social Security Disability Insurance, SSDI. So the SSDI program pays benefits to an individual that has worked long enough and recently enough and paid Social Security taxes on their earnings. The SSI program pays benefits to adults and children who meet SSA, or Social Security Administration's requirements for qualifying disability and have limited income and resources. While these two programs are different, the medical requirements are the same. They each have different work and financial rules in order to qualify, but both benefits are intended to provide financial support to individuals who are disabled. And an individual can go do a 10-minute questionnaire over at ssa.gov, and I can give you the address, and it's to see which benefits they may possibly qualify for. So does an individual have a Social Security number, or do they need one to apply for one? Yes, an individual can apply at this website right here, this page, for a Social Security number. After they submit their online request, they must visit the SSA Anchorage office with their documentation within 45 calendar days. Okay, so and you have to bring your acceptable documentation. It must be original, no copies, and it has to be certified, by an issuing agency, unexpired, and they must show name and date of birth or age. And once the application is approved, that individual will receive a Social Security card with their name on it by mail within 14 days. So who can receive SSI, or Social Security income? One, people with low income and few resources who are age 65 or older, or blind or have a disability, may be able to get SSI. Individuals 18 years or older are considered disabled if they have a physical or mental condition or a combination of conditions that keeps them from working. The condition must be expected to last at least 12 months or result in death. Children younger than 18 are considered disabled if the child has a physical or mental condition or a combination of conditions that results in marked and severe functional limitations. This condition must be expected to last at least 12 months or result in death. An individual is considered blind if they have vision no better than 20/200 for a limited visual field of 20 degrees or less in the better eye with the use of eyeglasses. An individual whose sight isn't poor enough to be blind may still qualify as disabled. So I want to talk a little bit about supplemental security income for children. So who is a child for SSI? So a person who is neither married, as determined by Social Security, nor head of a household and is under 18, or is under age 22 and is a student regularly attending school as determined by Social Security. How does the SSI disability program work for a child? Well, to be eligible for SSI benefits, a child must be either blind or disabled. A child may be eligible for SSI disability benefits beginning as early as the date of birth, and there is no minimum age requirement. A child may be eligible for SSI disability benefits until attainment of age 18. And when the child attains age 18, SSA will evaluate impairments based on the definition of disability for adults. And a child with a visual impairment may be eligible for SSI benefits based on blindness if the impairment meets the definition of blindness. And for more information, you could go to this webpage from SSA. And the disability application, okay? Whether you apply online or by phone or in person, the disability benefits application process follows some general steps. First, gather the information and documents needed to apply. The starter kits are a helpful resource for the information and supporting documents needed to complete the application process. An individual will need to provide their personal and income information to complete the interview to determine if they are eligible for disability benefits. For children 18 years and younger, a parent or legal guardian can utilize the child starter kit. For individuals 18 years or older, they can utilize the adult starter kit. Another thing is check the Compassionate Allowances online page at ssa.gov. The Compassionate Allowances are a way to quickly identify diseases and other medical conditions that, by definition, meet Social Security standards for disability benefits. These conditions primarily include cancers, adult brain disorders, and a number of rare disorders that affect children. The CAL initiative helps Social Security reduce waiting time to reach a disability determination for individuals with the most serious disabilities. Depending on an individual's diagnosis, they may qualify for a compassionate allowance. For Social Security, welcome to our online disability application. There is a great video from Social Security with a brief introduction to their online disability application process. And it is here at this site and also at this site. One is directly on the ssa.gov website. The other one is on YouTube.
Could I
And
take a picture of that, Roberta, or how would we be able to, will we get printouts of this information, or how you go? I mean, I couldn't copy that fast enough. I'm sorry.
No, you're totally fine. So this will be available. This information we will have later for you.
Oh,
To
okay,
have all of
great.
this.
Sorry.
Okay.
I am taking notes, but
No problem at all. And we don't expect everyone to take all this information at once. This is mainly to give an overview of this whole process. And then we're going to give you this information later so you could take more time, look at it, digest it, and then be able to do what you need to do. And we also have in the chat that Lisa is going to email the presentation and a few other things for all of you. So our next step is getting ready for your appointment or filing online. So one is an individual's appointment is either going to be in person or by telephone. There is a checklist for child disability interview, and there's a checklist for the adult disability interview. I highly encourage you to look at those lists so that you could be prepared beforehand. So when you're an individual's filing online, you want to refer to either the Child Disability Starter Kit, and then you go to SSI eligibility application for the child, or you can go to the checklist for online adult disability application. It's important to note, I wanted to bring these points, if an individual has an appointment with Social Security, it's very important to keep their appointment even if you do not have all of that information needed. Social Security will help you get any of that missing information. But please, if you have an appointment with them, whether it is in person or it's on the phone, please keep that appointment, okay? they also realize at Social Security that it takes time to get information, but please do not sacrifice your appointment with them. Okay, it's important to keep it. And if an individual has a legal guardian or a power of attorney, copies of that paperwork are needed to provide to Social Security. And during the interviews, limit or do not have side conversations. It's going to be really important. You want to be straight and to the point, and so that you can keep things going on with your process. Another thing is an individual wants to have direct deposit, be ready to provide that bank account number and the bank's 9-digit routing number. And your bank can help you with that to show you what that number would be. But like I said, if an individual wants to have direct deposit, be ready to provide that bank account number and the bank's 9-digit routing number. Individuals need to have contact information current and accurate. Make sure you give them the most current mailing address, physical address, and also a phone number where they can get in touch with you.
I'm sorry, is this okay to ask a question?
Sure, go ahead.
Oh, okay. I actually have an appointment with Social Security, but I haven't legally, Giuseppe turns 18 next month. I don't have the legal, all the guardian thing stuff done yet. Is that going to be a roadblock to my application with them?
That's a really good question.
Right.
So what I would suggest is I could talk with you after this because there's a couple of other different factors that go with that. So maybe we could table that question for afterwards. Would that be okay? Before, so we can, because it's going to take a little bit more to explain that.
Sure, no
Okay,
problem.
great. All
Thanks.
right, thanks. Okay, so applying by phone, you can call Social Security at 1-866-722, 772, excuse me, 3081. And it is 9 a.m. to 4 p.m. Mondays, or there's another 800 number to call. And that number is 8 a.m. to 7 p.m. Mondays or Fridays. And tell the representative that the individual wants to apply for supplemental security income. And it may take a while to speak to a person once you get on the phone. So please plan to be on the phone for a lengthy stay. And generally, you have a shorter wait time if you're calling during the week after Tuesday. But if you're going to do it, do not plan to call them during your 15-minute break, during your lunch break. You're going to have time because it's going to take a while to wait to actually talk to somebody. And then once you do, you want to have the time to explain to them what your questions are and then be able to take back the information they give you. You want to tell the SSA representative that you want to set up an appointment to apply for benefits. They'll schedule it and determine whether it's going to be a phone interview or in-person interview at the Anchorage office. And you could tell them your preference as well, but they are going to schedule it for you. The SSA representative will let you know if they will be sending paperwork in the mail or contacting you back by phone. They may also ask an individual to set up a My Social Security online SSA account at www.ssa.gov. It's really easy to do, and it's probably a good thing to have. After an application is submitted, Social Security may or may not contact the individual to get more information. The application will then be sent to SSA Disability Determination Services, and that office is actually right off of West Northern Lights in Anchorage, and there's the phone number. And it can take 3 to 6 months to review the application and medical records. And if you are going to be allowing Social Security to get medical records for the application, it's a good idea to give a heads up to your medical providers that you're doing that. And the thing is, why it could take 3 to 6 months to review that application is because some medical records from certain offices, they're not always going to be as soon as they get in that request that they send them out. They may only send out medical records once a week. So it may take a little bit. So that's why it's not always just Social Security, them having the time. It's also with the time that it takes to get back the records from all these different places. Okay. So it does take a little bit of time. Like I said, it could take about 3 to 6 months. After the review, the individual will get a letter in the mail with a decision. And if the individual is approved, SSA will check the financial documents that the individual provided with their original application. And following all this, the individual will get another letter in the mail from SSA stating how much money they will receive every month. Checking the application status and or appeal status. So after submitting your application, you can check your application or appeal status to see where you are in the process and when you can expect for SSA to render a decision. You can check your online www.ssa.gov account, or you can use the automated phone assistance at 800-772-1213. And when you hear, "How can I help you today?" say application status. Actually say those two words. And then also, if an individual is staffed or hard of hearing, it'd be good to call the TTY line. So let's say it comes about that you don't agree with the decision that Social Security has determined, and you want to appeal it. So if you're going to appeal a decision that Social Security has made, you have 4 opportunities to appeal the decision. One is you request a reconsideration of their decision. You must request this within 60 days of their decision. And you could fill out a request for reconsideration, the form at this webpage, and you can mail or fax the completed form, or you can call the 800 number and tell the representative you want to submit a request for reconsideration of a decision Social Security made. Or if you're a deaf or hard of hearing individual, they can call the TTY line and request this as well. The other option is to request a hearing with an administrative law judge. If you do not agree with Social Security's response to your request for reconsideration, you can fill out the request for hearing by administrative law judge and mail it or fax the completed form to the 800 number and tell the representative you want to request a hearing with a judge. And you could also do this on the TTY line if you're a deaf or hard of hearing individual. Your third option is request for a review with the appeals counsel if you do not agree with their decision made by the judge in your hearing. And you could fill out this form. And then you could also do it by phone, and you could tell the representative you want to request a review of the decision made by the judge in your hearing. And for deaf or hard of hearing individuals, they can use the TTY line and request it. And your fourth option is you can file a review by a federal district court if you don't agree with the appeal counsel's response. You could also file a civil suit within 60 days of their decision. So there's 4 options. Start with the first one, and then you can go all the way to the fourth if necessary. What happens to an individual's childhood disability at age 18? If an individual is eligible for disability benefits as a child 2 months prior to attaining age 18, SSA will review their case. During this review, current medical conditions will have to meet the disability requirements as an adult. So when SSA initiates the medical redetermination, they will use the adult criteria to determine if you're eligible for disability benefits as an adult. And SSA uses the same criteria for adults who file new SSI applications. And there are work opportunities for youth who are getting SSI. SSA, Social Security Administration, does not count most of a child's earnings when they calculate the SSI payment. They count even less of a child's earnings if the child is a student. So SSA subtracts the cost of certain items and services that a child needs to work from their earnings in calculating the SSI payment. If an individual is 15 years or older, they can establish a plan to achieve self-support, or it's PASS or PASS. With a PASS, the individual can set aside income for a work goal. SSA will not count this income when they calculate the SSI payment. An individual's Medicaid coverage can continue even if their earnings are high enough to stop an SSI payment. Social Security has two programs that assist youth who get SSI disability benefits and want to go to work. One is the Work Incentive Planning and Assistance, or the WIPA program, and then the Protection and Advocacy for Beneficiaries of Social Security program, and that's the PABSS program. The Social Security office in Anchorage can provide more information about these programs, as well as the Social Security work website, and that's at www.socialsecurity.gov/work. There are SSI benefits for youth who are blind or have disabilities in foster care. So youth who are blind or have qualifying disabilities receiving Title IV federal foster care benefits usually cannot be eligible for SSI until foster care payments have stopped. SSA may accept an SSI application from a youth up to 180 days before their foster care eligibility will end due to age. So up to 6 months before their foster care eligibility will end due to age. And let's say somebody's homeless. SSI can help a person who is homeless get housing by providing monthly payments, but a person doesn't need a home to get SSI. Social Security can arrange to give SSI payments to the homeless electronically. An organization can serve as a mail drop location, allowing a person who is homeless to pick up important Social Security correspondence at the organization's address. And then there are representative payees. When an individual who receives SSI is not able to manage their benefits, a representative payee receives the SSI payments on their behalf. Representative payees are responsible for using SSI payments, to take care of the basic needs of the person receiving benefits. We have an online SSA account, and the online SSA account provides access to online services regarding an individual's account. To review your Social Security statement, you can verify your earnings, you can get estimates of future benefits, print a benefit verification letter, change your direct deposit information, or request a replacement Social Security card if you have no changes. And I wanted to point out about the benefit verification letter. A benefit verification letter is to show that you receive benefits and have submitted an application or don't receive benefits. This documentation is often needed for loan applications, housing assistance, and other processes that require verification of your income. It may be referred to as a proof of income letter or a benefit letter, and it is personalized based on the status of your Social Security benefits, supplemental Social Security income, and Medicare coverage. Not Medicaid, but Medicare coverage. An individual can also use the automated phone line 24 hours a day at 800-772-1213. And when they hear, "How can I help you today?" you can say, "Proof of income." And individuals who are deaf or hard of hearing can call the TTY line and request that. So how about replacement Social Security cards? Because that does happen at times. So depending on your situation, you may need to apply for a replacement card online. You can do it online at www.ssa.gov/number-card and then /replace-card/get-started. Or you can go to the SSA office in Anchorage and fill out an application for Social Security card, which is a form SS5, and which you can get off line as well and bring it to the SSA Anchorage office, and along with an unexpired documentation. And the web page there provides what documentation will be required. And documents must have original, they must be original or have a stamp, a signature, or a raised seal from the issuing agency, and they do not accept photocopies. What if an interpreter is needed? SSA will provide an individual with an interpreter free of charge if they request language assistance or when evidence is such that assistance is necessary to ensure they are not disadvantaged. The individual is not required to provide their own interpreter. If they prefer to use their own interpreter, SSA will determine whether the interpreter meets SSA requirements. These interpreter services are available whether by phone or in the Social Security office. You can call 800-772-1213. If an individual speaks Spanish, press 2. For all other languages, press 1. Stay on the line until a representative answers. An interpreter will be contacted to help with the call. If an individual's business cannot be completed by phone, then SSA will make an appointment for them in the Anchorage Social Security office and arrange for an interpreter to be available at their time of visit. And Social Security information in other languages is on their website, and information is available in Arabic, Armenian, Traditional Chinese, Simplified Chinese, Farsi, French, Greek, Haitian, Creole, Hmong, Italian, Korean, Polish, Portuguese, Russian, Somali, Spanish, Tagalog, and Vietnamese. So contacting Social Security, you could do it online at the SSA website, www.ssa.gov, which you could apply for most types of benefits. You get online copies of Social Security information and publications. You can get answers to frequently asked questions or create a personal My Social Security account. By phone, you can call their 1-800 number. There's one number for 9 a.m. to 4 p.m., Monday through Fridays. And then there's another 800 number for 8 a.m. to 7 p.m., Monday through Fridays. And generally, for a shorter wait time, call during the week after Tuesday. And then there is a TTY line for individuals who are deaf or hard of hearing. If you'd like to go in person, you could go to the SSA office at 222 West 8th Avenue in Anchorage. And that is Monday through Friday, 9 a.m. to 4 p.m. And please note, if an individual just goes to the Social Security office in Anchorage, they are not guaranteed an appointment. They may be asked to schedule an appointment and then come back at another time. Okay, so I wanted to be clear with that, because just because you show up in person at Social Security in Anchorage does not guarantee you an appointment. They may need to have you just make an appointment and then come back. Then, for other resources and information, these are some really great ones. And when you see it, when you get the information later, there's Understanding Social Security Income homepage. There's the 2023 edition. And then there's also links to SSI spotlights. And these spotlights give you detailed looks at some of the program rules found in the booklet, Understanding Supplemental Social Security Income. You could also get more information from the ADRC, or the Aging and Disability Resource Connections office in Anchorage, or at the ADRC in Matsu at 777 North Cruzy Street in Wasilla, and that's at the Matsu Health Foundation building. And there's also Disability Law Center, and there was a great publication that they put out, Applying for Social Security Disability Insurance Benefits in Alaska, and there's directions on how to get that offline. And then also at our website, Stone Soup Group, and you could go in our main page and then go to trainings and events and click on the link, and you could see some past trainings and event recordings in our archives. There is one from our DDRC Lunch and Learn series, SSI, Medicaid, and how they connect to the DDRC. And then also the transition series, employment while receiving Social Security benefits and Social Security work incentives. And here is our main office in Anchorage, and you're welcome to contact us there for more information. Well, thank you, everyone. And I wanted to share with you about Alaska Medicaid and TEFRA, what they are, and how do you apply for it. So, first one is, what is Alaska Medicaid? Alaska Medicaid is an entitlement program that assists Alaskan individuals and families with healthcare coverage. It's jointly funded by federal and state governments. The Division of Public Assistance, otherwise known as DPA, is responsible for determining the eligibility of individuals and families in need of Medicaid benefits. For Alaska Medicaid, the categories include Medicaid expansion, family Medicaid, breast and cervical cancer, Denali Kid Care, under 21 Medicaid, adult public assistance, related Medicaid, nursing home Medicaid, home and community-based waivers, and TEFRA. And each category has a unique eligibility rules and guidelines. You need to be enrolled in Medicaid if you are pulled for a home and community services-based waiver. Even if someone has benefits through their native corporation, they need to have Medicaid in place when pulled for the waiver waitlist. So how can I apply for Medicaid? Well, you can apply now one of the following ways. One is you can go to www.healthcare.gov and apply for a healthcare plan or Medicaid through the federal marketplace, or you could go to www.myalaska.gov to do an online application through the Division of Public Assistance self-service portal, or you can download an application, which they also call the Gen 50C form, and mail it in or drop it off at a public assistance office. Or you can apply online. You can go to myalaska.gov to do an online application through the Division of Public Assistance self-service portal. And you also can do where you go to, this is the My Alaska. And this is, it may be familiar to you with My Alaska, where we go for PFDs. We go to register and check them out. But there is where you can go to the there, and you can access that for Medicaid. And you could go to the ARIES, or the Alaska's Resource for Integrated Eligibility Services, and that's a self-service portal. And this is a great way that you can start your application. You can go to this first one where it says, answer a few questions to see if you may qualify, and then you can start an application, and then you could review some details. So that's one way to do it. You can also, if you'd like to do a Medicaid application walkthrough video, and State of Alaska DPA Medicaid, they did put through an electronic application walkthrough video that you can access through this webpage. And it's a 12.5-minute video that is a walkthrough how to fill out the application for children under 21, pregnant women, and parents or caregivers of children under age 18. Adults between ages 19 to 64 who are not receiving Medicare and may be eligible under Medicaid expansion can also apply for Medicaid online. So do you want to do a paper application? You can. You can download the application, which is a Gen 50C form, at this site, print it out, complete it, and mail it into or drop off at your local public assistance office. They would also have forms as well. And if you do not have access to a computer or a printer, you can get a paper copy from the lobby of your local DPA office. You can actually go to the public library, a public health nurse, or an ADRC or a DDRC navigator. So I have copies as well, a Stone Soup group that we can share with people, and it's available at any time. So This is a listing of Division of Public Assistance offices statewide. So theoretically, you can put in at any of these offices. We have for Anchorage, we have for the Matsu district, and then it goes all through other ones that are available. I have in the most current contact information for them and also email information, and you will be receiving this as well so that you can have it. And then I want to note, please notice that email and voicemail messages are supposed to be responded to within 2 business days. If you have not received a response within 2 business days or 48 hours, please contact the office at that address, and business hours are weekdays from 8 to 5 p.m. and interviews are conducted telephonically Monday through Friday from 8 to 3 p.m. We also have, this is the front page of the Gen 50C form, and I highlighted some areas. So one of the things is that how long will your application take? Well, once you submit it, it may take up to 30 days to process your application. We have had a little bit of a backlog with Medicaid, so it could take a little bit longer, but please have patience. And so another thing is what you may need to apply for health insurance. There is a list of documents here. Please take a look at that to what you will need to bring with you. And then also Medicaid, it offers medical coverage to low income individuals, people over 65, disabled, blind, or pregnant women and families with dependent children. And it also helps with Medicare Parts A and B premiums. And this information page, it says, read and keep this page for your records. And I also, before we go any further, whenever you're going to make an application out, whether it's going to be electronically or it's going to be a paper copy, please make a copy of your application, whether you are printing it out, you're doing screenshots, or you're taking a picture by phone. Keep a copy of your application. This way you know what you put down. And also, as we go through the form, the second page talks about what you may need to give to the Department of Public Assistance Office. These are forms of identity. Then also here is unearned income. And that's an agency letter showing money received, such as Social Security, SSI, veteran benefits, benefits from the VA, child support, alimony, unemployment, and retirement. And then I'd like you to look at other documents which may be required, such as bills or receipts for child care or dependent adult care, proof of application for Social Security or supplemental security income, eviction notices or utility shutoff notices, and a copy of a court order, such as if there's custody or different things that you need to bring. And let's go to the next page. Okay, application for services. This is you going for Medicaid for Denali Care and Denali Kid Care. You're going to print out the name of the individual, if there's any other names that are there, home address, want to make sure that you have the most current and accurate one, and then make sure if you have a different mailing address to please put that down. And then as you go through the different questions, you can also see if you'd like to apply for SNAP, which is to have some supplemental monies. It's for food. And then at this bottom of the page, you will need to sign and date. There is also the second part of this is people in your household. If you are just applying for your guard, if you're a guardian, if you're applying for someone, or you are an 18-year-old individual applying for Medicaid, you are considered your own household. They are a household of one. So for people in the household, for an 18-year-old who's applying for themselves, or if a guardian is applying for an individual, that it's only based on that individual and they are counted as a household of one. And there is a question right here where it talks about, do you plan to file a federal tax income return next year? You can apply for health insurance. Even if you don't file a return, you can need to address that question. We also go through if you have other insurances, you're going to need to note that as well. And they also would like to know if you want help for paying medical bills from the past 3 months. Now, when they say that, it's not, you need to have documentation for that as well. And it doesn't mean that you automatically are going to get that reimbursed. It's for their consideration. And if they deem that that is something they can cover, then that may be something good that can help you as well for some past bills that still need to be paid. It goes on, if you're applying as a family, then you will need to list out each individual member as a whole family, not if you're doing it individually. And then it talks about income in somebody's household. Sometimes for our young individuals or young adults, they may not have an income, so they're not going to have something to put down there. Let's see. So we go down to page 14. It talks about, for all self-employed household members, please answer the following. So that's for somebody who has their own business, they're self-employed. If you are not self-employed, you don't answer it. And then also you're going to go down to, I wanted to put where it says, there's number 97 here where it says other income. And it says for health insurance only application, you don't need to tell about child support, veteran payment, or supplemental security income. You will if you're applying for food assistance and other assistance. But if it's just for the health insurance part, you do not have to include those in that section. Another thing is it talks about in this section for other income, and for most young adults, they'll have where we get a state of Alaska PFD. You know, all of us get it. And basically, we know we're going to get it. We know that it's annually, but we're not going to know the amount until just before they give it. So for that, you could just put the individual name who's applying. You could put State of Alaska PFD, and then you could put annual for the amount. And then if somebody does have, if they are Alaska Native or Native American, they have health corporations that they belong to, that information would go here. And if someone, let's say, for example, a young adult, they also have insurance under their family, that's still allowable. If somebody, they could still have insurance with their parents and also get Medicaid. But you do have to include that information here. And then if you're just applying for Medicaid benefits, medical benefits only, then you could stop. If you're going on and you want other disability related Medicaid or other public assistance programs, then you have to go to the next steps. I want to talk about something called MAGI, which is modified adjusted gross income. The individual, the Internal Revenue Service, or the IRS, calculation of income and household size. MAGI will be used to determine eligibility for health insurance programs, including Medicaid and Denali Kid Care, as well as premium cost sharing assistance for tax credits provided to low and moderate income individuals under Affordable Care Act. Then there's types of Medicaid. Under MAGI, it's for parents and caretakers, expansion adults, children under age 19 with or without insurance, adults ages 19 to 21, and pregnant women. And then there's older age and disability related Medicaid for seniors age 65 and older, people with blindness or other disabilities, long-term care, home and community-based waiver recipients, working disabled, TEFRA for children with disabilities at home, and Medicare premium assistance. adults or adults between the ages of 19 to 64 who are not receiving Medicaid and may be eligible under Medicaid expansion and can apply for Medicaid. Then we have, this is a release of information page that has to be signed with the Medicaid application. And then there is also an acknowledgement of understanding and statement of truth that you will have to initial, and the person applying will have to assign, or their guardian. And then this is in case that there are individuals that may needed to be contacted that know you and can provide information. And one of those people could be your landlord, for example, if you were going for something, for some type of public assistance with paying towards rent, and maybe if you were going for other things as well. And then there is this page where it is health coverage from jobs. So this is where somebody could report that as well. If, for example, a child who is an adult is applying for Medicaid and they still have coverage under their parents, this is where the parent would put their information. And then there is an employer coverage tool. This is the page that actually you would need to provide information from your human resources department at the parent's job. They can help with some of this information. And then if a person wants to register to vote, they can do so and sign this application from here, but you do not have to. Okay, it's only if somebody decides to, but they do not have to. And then this is appointing an authorized representative. So this is where, if you would like to allow someone to represent you on all matters related to your application and case. Okay, so the paragraph states you can give a trusted person or an organization permission to talk about your application and case with us, see your information, and act for you on matters related to you and to your public assistance case. This person is called an authorized representative. An authorized representative can make changes to your public assistance case and has access to the information in your case files. You will be held responsible for any change that is made to your case by your appointed authorized representative, up to and including potential fraud charges. Okay. Now, the thing is that you can also withdraw your permission that you give to somebody to be your authorized representative as well. Now, for example, oh, sorry about that. Or you have permission to release information. And is there somebody that maybe you want to share information about your case and your application? And sometimes that could be somebody who is a parent or a sibling or a trusted individual to that person, that maybe they need some support when they're filling out a form, or they would like to have that person support them when they're going down to DPA to talk about their application or handle things. And so it's good to have that signed beforehand, so it doesn't look on a phone call or in an interview that somebody was coercing somebody to have them be a part of that process. And then if a family is applying, or an individual who has child support information, this is where it would go. And then voter registration, again, is on this page. And then these are a listing of the public assistance offices. And regardless of which Medicaid program you participate in, to keep your benefits current, complete and return your renewal application by the requested date. If you turn in your renewal application on time and you are found eligible to continue receiving benefits, there will be no gap in your coverage. They have where usually Medicaid may send to an individual who already has Medicaid a renewal form. It'll look like a yellow form, and you need to have that in. Whatever you need to do to renew that, make sure you have that in on time. Make sure you have all the documents they ask for, and get it into Department of Public Assistance as soon as possible. You receive it in the mail. It usually will come at the same time every year. Be on the lookout for it. Talk to your office to ask them about when do they think that you will get your renewal form sent to you next time, and mark it on your calendar and be looking for that mail. Because if, according to DPA, whether or not you received it, you are still responsible to get it in. It's not their problem. So if you know it's going to be about a certain time and you still have not received it by mail, go get yourself one of those renewal applications and put it in. Check with us at Stone Sioux Group. Check with other agencies. Go down to DPA and let them know you haven't been received that renewal form yet. But whatever it is, be mindful of it. Mark it on your calendar. It'll save you a lot of headaches later. Because, like I said, Department of Public Assistance, they will have the stance that it is your responsibility to get in the paperwork. So there is an Alaska Medicaid recipient information helpline. It's 800-770-5650, and you press option 2. And if you're a recipient or a recipient advocate and have questions about Medicaid coverage, you can call the number, and it's statewide, Monday through Friday, 8 to 5 Alaska time. And after hours, please leave a message, and they should call you back the following business day. You can also email the helpline staff at memberhelp@conduent.com, and the recipient services representatives should assist you with your questions about services and provide a list of Medicaid enrolled providers and explain how to use your Medicaid benefits in general. So I would suggest to you to get yourself a Medicaid recipient's handbook. And the purpose of this handbook is to help you understand available programs, and if you are eligible, how effectively to use that coverage. And this handbook is designed to provide detailed and individual information. I'm sorry, excuse me. It's not designed to provide detailed and individual information, but instead to offer a broad overview of the program and services available. You can get an online copy at Medicaid recipient handbook at this website, or you're always welcome. You could ask us at Stone Sioux Group, and we can email you an online version as well. And it's a great resource to have because it can tell you what is and what isn't covered, and also tell you how to access it or what form you need for this, who do you need to call. It could be a really great resource. And then I like to add about TEFRA, or the Tax Equity and Fiscal Responsibility Act of 1982, otherwise called TEFRA. So TEFRA is a Medicaid program that was developed with specialized requirements that may allow children who would not typically qualify for Medicaid because of family income to receive specific Medicaid benefits. The child needs to meet the medical, developmental, or psychiatric condition that fits the supplemental security income, or that SSI definition of disability. Only the child's personal income and resources are used when determining eligibility, not the parents. So not all children who are determined disabled or have high medical costs qualify for this program. A family has to apply for Medicaid and be denied due to the parent's income by DPA before the parent can apply for TEFRA Medicaid for the child. The age limit for TEFRA Medicaid is set at 19 years old, but however, it's expected that at age 18, a TEFRA child or the child's parent should apply for supplemental security income and move to adult or public assistance and related Medicaid prior to turning 19 years of age. Denali Kid Care and TEFRA Medicaid provide the same Medicaid healthcare coverage for a child. And a TEFRA care coordinator can assist you with the initial process of applying for TEFRA, as well as the annual application. And if somebody is interested in TEFRA, we can get you at Stone Sioux Group a listing of TEFRA care coordinators in the state of Alaska, and you are welcome to contact those individuals and see who would be a right fit for you. As usual, if you have any questions about this presentation or other ones, you are more than welcome to contact us at Stone Sioux Group, and we'd be very happy to provide assistance. And thank you.